Welcome back to Face the Nation. Michael Dowling is the president and CEO of Northwell Health, the largest healthcare provider in New York State. He joins us this morning from Long Island. Thank you for joining us.
Thank you so much. Pleasure to be here.
I know in addition to your day job, Governor Cuomo had also asked you to help increase hospital capacity across the state. This morning, the defense secretary said that about 1,000 military medical professionals will be sent to New York today and tomorrow. Does that solve the problem? Is New York poised for this apex now?
Yes, I think we're as prepared as we can possibly be. Obviously, if another resource comes in from the federal government, that is great, as long as it is a resource that can help us. We have had a situation in New York where we've had federal assistance with the Comfort Ship on the west side of Manhattan and the Javits Center. And up to this point, they haven't been able to take that many patients because of the criteria that they use for admission to the facilities. So to the extent that they arrive here, to the extent that they can be helpful, obviously it's all great. We welcome all help, and we appreciate the offers. And if it all works, I think we will all be better off for it.
Is staffing the chief issue right now?
Well, staffing is always an issue because the severity of the issue, we've been in this now for a couple of weeks, and the intensive care staff, the physicians on the front lines, we have to use staff over and over. We have to put staff on overtime. We are getting staff in from around the United States. We're getting staff from upstate New York. So finding the capacity is one thing. You can create the beds. That's the easiest part, because you can create an ICU bed or a bed pretty much any place, and we have plenty of beds. The issue that becomes each and every day making sure that you have the right staff with the right skill levels to make sure that you can take care of the patients in the optimum way that you would want to take care of them. So, yes, staff is always an issue. But we're well prepared at the moment, and we will be well prepared no matter when that apex comes, whether it's this week or next week. We will be prepared.
There was a memo from Northwell, from your company, published by Politico, outlining guidance to medical staff, basically to help triage and decide who gets a ventilator and who gets to stay on one. Are we close to that point of having to make those hard decisions?
Yeah, we are not at that point at all. We have sufficient ventilators for the foreseeable future, and we're obviously getting more supply. And Governor Cuomo has been a major quarterback in that effort. The policy that you reference is a draft policy. It is something that we like to prepare for the inevitability in case that we ever have to do something in the future. You have to have a policy prepared well in advance. Mm-hmm. I don't think we will ever get to that point, but it would be foolish to wait until you have a disaster and then try to develop the policy during that situation. So this is all preparation. It's just a draft. It's not happening. We hope it never happens, but if it does, we are prepared.
Understood. If a patient has to go on a ventilator, what is the chance of survival? What are you seeing?
Well, what we're seeing, and I think it's across all areas, all facilities, that if you go on a ventilator, there is about a 20% chance that you will survive. We have had, obviously, patients survive off ventilators, but it's about a 20% chance. And as you know, people on ventilators a long period of time. But we've had successes. And the other thing I'd just like to mention here, because I think the public sometimes can get not always the right information. We've had lots of people discharged from the hospital successfully after they have been treated, many after they have been on a ventilator. Mm-hmm. So in our health system alone, about 300 people each and every day after successful treatment for the COVID virus actually go home. That is success. That's what we've got to also be talking about and thinking about and celebrating. That's the good news. And I think good news is what everybody needs right now.
What are you telling your hospital workers, the doctors and nurses who work at all of your facilities? Do you have enough protective equipment for them?
Yes, we have enough protective equipment. And what's amazing here is that at times of crisis like this, people's character reveals itself. You see extraordinary work being done by doctors and nurses. You see hospitals being retrofitted to put beds where beds never before existed. You see sadness among employees when things don't go well, but you see joy and celebration when there are successes. we are seeing in many ways the best of humanity. I'm out in the meeting with the physicians and meeting with the staff on the front lines, and I can tell you that we should sit back and say how fortunate we are to have people with that commitment, that compassion, that courage to do what it is they're doing each and every day to protect the rest of us. We are very lucky with the healthcare systems that we have. We are very, very, very fortunate. We should never forget about it. And so when this is all over, and when you can get close to people, eventually when social distancing is over with, for everybody out there, if you see a healthcare worker, especially a nurse or a doctor, have been on the front lines, please give them a hug. Don't do it today. Do it later, because these are
we'll clap. We will clap
people.
for now, as Dr. Fauci recommended. Thank you. Thank you, Mike. Mike Dowling there of Northwell Health. And we go to Connecticut and former FDA Commissioner Scott Gottlieb. Thank you for joining us again. You just heard the descriptions there from a hospital on the front lines up in New York. Dr. Fauci was pretty direct. He said it's not going to be an easy week. Do you believe that, as he says, mitigation is working?
Mitigation is clearly working. We're seeing cases slow in the Northeast and the northern states. The Sun Belt is going to be in for a tough week. We're going to see cases in the Sun Belt start to accelerate. I think the New York City health system is going to be brought right to the brink, but they're not going to go over. They're expanding their capacity to keep pace with their surging demand, and really a historic effort. And I don't think they're going to run out of ventilators. They're doing things to convert existing devices into ventilators, and I think they'll keep pace with it. But it's a historic effort that's underway in New York right now, and we should make no mistake what they're doing to try to keep pace with the increased demand. That demand is likely to peak in the next week or two. So we're going to see a backdrop this week of severe strain on the New York City healthcare system at the same time that cases in the South start to accelerate.
But what are some of the lessons of what we're seeing in New York right now? Because we're hearing, and I know you've been tweeting about some of the unusual things, younger patients being hospitalized at alarming rates in New York in particular. Why is that happening?
Right. Well, we don't understand. I mean, this infection is not just an infection that's causing severe outcomes in older Americans, as was initially put forward. A lot of young people are having bad outcomes, are intubated right now in the ICUs with no comorbidities, no risk factors that would predict a bad outcome. There's pregnant women intubated and in hospitals right now. We need to understand that. There's been no serious publication by the CDC of the collective clinical experience in the United States right now. So doctors are making decisions based on anecdote and their own clinical experience. There's really no excuse for that right now. We need to start getting literature out right away to inform providers on what's working and what's not. You heard the hospital chief there say about 70 to 80% of people who get intubated succumb to their infection. That's what I'm hearing from other hospitals. Doctors are now experimenting with more fluids. They're experimenting with high flow oxygen. They're experimenting by putting patients in the prone position, meaning laying them on their stomach rather than on their backs when they're intubated. This is stuff that doctors are figuring out from their own clinical experience, but really what we should have is literature published by the CDC that delineates what's working and what's not, so doctors can take a more systematic, data-driven approach to these things.
So tell me about the timeline here. The president said this week that he thinks we should be able, as a country, to hold mass gatherings like the Republican National Committee in August. Is that too aggressive a timeline for you?
I think things are going to be permanently changed coming out of this until we get to a vaccine and we can fully vanquish this. We're not going to see a V-shaped recovery or a quick snapback, absent the ability to get a highly effective drug in the hands of doctors that can mitigate the risk, either use as a prophylaxis to prevent infection with people who get exposed to this virus, or treat people who get the virus and are likely at a high risk of a bad outcome. We can have that kind of drug by the summer and certainly by the fall. I don't see the kind of deliberate industrial approach, all hands on deck approach to trying to get that kind of therapeutic. And there are things that are promising right now that could be brought forward more quickly. But absent that, this is going to be an 80% economy. There are things that are not coming back. People are not going to crowd into conferences. They're not going to crowd into arenas. The marginal customer is not going back to movie theaters and cruises and Disneyland. And we need to accept that. Now, what changes that equation is technology, but we need a deliberate approach to getting that technology quickly.
So you've mentioned technology. The Fed president from St. Louis mentioned technology. Dr. Fauci has mentioned technology and surveillance. Specifically, what does that look like in the United States of America, and how far are we from getting that?
Well, the massive surveillance system that we need to detect infection quickly, we're hopefully going to have in place. We should have that in place. We'll have the tools to do that. So we'll be able to identify cases when there's small outbreaks in the fall and use case-based interventions, basically isolating people with the infection in their close contacts. But what we also need is a drug that could be used either as a preventative tool, a prophylaxis, as a bridge to a vaccine, or a treatment for people who are likely to have a bad outcome with this virus. There are about 4 or 5 drugs that I would say are in advanced stages of development that could be available by the summer. We need to place significant bets on each of those drugs and try to pull them through more quickly. This is a time for placing bets. This is a time for an industrial approach to this. It's not happening right now. I think it needs to happen. There's still time, but we need to recognize how important that is. Otherwise, the scenarios of this country just snapping back and being something more than an 80% economy just aren't going to come to fruition, and we need to prepare for what it looks like when you have a slower economy and more people unemployed in the fall.
I think that's an important point, because you're saying there the science is not supportive of the economic theory that this is just going to be a sharp return to what was normal.
Not unless we have the kind of breakthrough that we should be able to obtain. Like I said, one of these drugs should work. The strategy that looks the most promising are these antibody-based drugs, where you basically develop an antibody that can directly target the virus. There's 4 experienced companies working on this. There's every reason to believe this strategy should work. It's worked in other settings of viruses. We need to start pulling those through more quickly. And there's a couple of antiviral drugs that directly target the virus and block its replication that look effective, and maybe used early in the course of the disease will be effective. Nothing's a home run here, but we don't need a home run. What we need is a better toolbox, a good medicine cabinet, coupled with very aggressive surveillance. That could be enough to really change the contours of the risk in the fall and allow people to feel comfortable going back out again.
All right, Dr. Gottlieb, always good to talk to you.
Thanks a lot.
When we come back, a look at the devastating financial impact on some of our viewers who are small business owners themselves. Stay with us.
This recovery is going to take small businesses years, if we're going to recover at all. And I'm really afraid that without more stimulus help in another bill, all of our favorite small businesses in our cities and towns might be lost forever.
My business is a part of the gig economy, which means that we work large and small events such as basketball games, football games, or concerts. So as long as people are not allowed to gather together, we have no prospect of making money.
I've had people that have worked here for 7 years, you know, like, these are my kids. Like, I feel responsibility towards them like I do my own children. These kids aren't sitting on savings accounts. Like, these are hourly workers, they're tipped workers. As a parent, to not know how to help your children through something like this, it's heartbreaking, you know. I don't know how to help them.
Those are just 3 stories from business owners who are facing some real financial uncertainty due to the coronavirus crisis. To help us put the experiences in context, we bring in CBS News business analyst Jill Schlesinger, who joins us from Long Island. Jill, you just heard some painful personal experiences, and we know even if you're not one of the 10 million Americans who just lost their job, this was tough. How should people at home be preparing?
I think this is one of those back to basics moments. You know, you hear these stories, I hear them all the time now, and it's really gut-wrenching. So what do you do with this information? You look at your own personal financial situation. You start prioritizing your bills well in advance of anything bad happening. The Consumer Financial Protection Bureau actually has a really good worksheet on its website, consumerfinance.gov, and you prioritize. Obviously, you put your food first, and then you go to your shelter, you go to your insurances, and if you have lost your job and you feel thwarted by your state's unemployment insurance platform, keep trying. And also know if you've lost your health insurance coverage, the Affordable Care Act actually allows you a special enrollment period if you've had a loss of income and a loss of a job. So you should absolutely check those things out. And be sure to know that if you ask landlords and utility companies for forbearance or a little breathing room, they're most likely going to give that to you. So don't hide, check out what you need to do, and ask for help where you need it.
But for some of the small businesses that we've heard from, they are trying to ask for help and they can't actually do it because the applications aren't up and functioning at a lot of the banks that will be lending out the money as part of this government program. What are you hearing about whether the money set aside was enough and if this is going to get going soon?
Well, I think that frustration on Friday was pretty dramatic. I must have gotten 100 different screenshots from people who had frustrations trying to apply, where the banks themselves were simply saying, we don't have enough information from the government. Then throughout the day, it seemed to get a little bit better. I would say if you're a small business, be very careful. Go through the programs that are available on the SBA website. Then you will apply. From the perspective of, is this enough? My fear is that the way the program is set up is essentially for companies to be able to bring their employees back on their payrolls, and they may not be up and running in 2 or 3 months. We got a data out, or a poll out rather, from the Chamber of Commerce, and when they polled a number of small business owners, 24% said they are going to be out of business within 2 months. So
Wow.
we've got to get the money faster to these people. They need help.
Does the economy look the same on the other side of this crisis?
I have been interviewing economists for the last, say, 6 weeks, and the views have really changed pretty dramatically from week to week. I don't think we will have an economy that is the same when we come out of this. You heard Dr. Gottlieb talk about an 80% economy. You've heard different people say that there's going to be winners and losers out of this. What I know in my heart, and I think what most of us are experiencing, is this is a once-in-a-generation kind of recession. It is going to be worse than the Great Recession. We are going to come out of it, but we are very clear in this. This economy and all of us will be changed forever.
Jill, thank you for your insight.
Sure.
And we have more of those stories from business owners on our website at facethenation.com. And we have this programming note for you. Scott Pelley reports tonight at 60 Minutes about how restaurants and other small businesses are being impacted and how they're trying to help out others. Scott spoke with New York restaurateur and the founder of Shake Shack, Danny Meyer, tonight on 60 Minutes. Isolation, stress, uncertainty are just a few of the mental health challenges affecting the country during this crisis. Dr. Luana Marques is the president of the Anxiety and Depression Association of America. She also teaches at Harvard and practices at Massachusetts General Hospital in Boston. That's where she joins us from this morning. Doctor, it is really hard to think of any kind of comparative event to what we are going through right now. The president has said he expects massive drug use, massive depression, massive numbers of suicide, disease. As a medical professional, is that the mental health impact that you're seeing?
Margaret, it's really difficult for a lot of my patients and certainly the mental health of the country in general. I think before we even talk about the magnitude, it's important for us to first remind our country that it's okay not to be okay right now. It's important to remind our country that it's okay to have strong emotions. And this is why, as we turn on the news every morning, and we're hearing stories of death, of loss of economy, of grief and sadness, we quickly start to feel our heart pounding and we feel the sense of tension, anxiety, and fear. And that is our normal fight or flight response, our biologically adaptive response in moments of tension. We just heard the president and Dr. Fauci talk about the next week being a very difficult week. And so the first thing I want to talk about before we even get to the magnitude of this is to remind our fellow Americans, all of us might have some of this adaptive response, and that's okay. It's just up to a point. Eventually, it does become too much.
So what are you telling people to do about that?
There are 3 things that I think are really important for us to do, Margaret. The first one is to remember that we are on the state of fight or flight, and we need to do anything to cool off our brain. So the 3 ways that you can do right now if you're sitting at home. The first one is to remember to unplug and to anchor. And what I mean here is give your brain a break from the news a little bit. Allow your brain to settle. And I know it's hard to do it right now. So by unplugging, you're bringing down that fight or flight. And then what I encourage you to do is to anchor on something that cools your brain off. Walking, meditation, calling a friend. The second thing I urge all of us to do, and this is not optional, is to charge up, is to be able to eat, sleep, and exercise. Those three things are things that we know help our mental health, but also help your immune system. So figure out what you're going to do, how you're going to do it, and why you're going to do it, and anchor on something that gets you going. For me, I've been walking and exercising because it's important for me to stay healthy for my family and for my patients. And finally, I urge us to be of service. We know that helping others not only makes them feel better, but also ourselves. So let's call an elderly neighbor. If you can afford, send food to those that actually need it. Or if you're sitting at home and you know how to sew, let's sew masks and help those that need it right now.
Well, what about those who don't have the luxury of staying home, the medical workers in particular? How do you counsel them to continue going back in and helping people when they themselves may be in distress?
So some of the techniques I mentioned are important to them, but you're absolutely right, Margaret, they're really suffering. I did a webinar at Harvard Medical School this week for first responders, and I heard questions like, what do I do if I'm about to have a meltdown in the emergency room? How do I cool off my brain after an 18-hour shift? And that's not unique to the Harvard community. We are seeing this globally. New research coming out from China, published in JAMA Psychiatry, shows that frontline responders are reporting 50% more depression, 40% more anxiety, and 35% are reporting difficulty sleeping. So I'm going to urge them to really figure out how to cool off their brain. One of the suggestions I gave to a friend who is a doctor is, if you are in the emergency room and you're rushing around and you're about to go from room A to B, take a moment to breathe. Just 30 seconds, you can cool off your brain. Turn your phone off for a little bit. Transition going home without listening to the news. And rely on your fellow first responders. They are your social support, and they're here for you. And as mental health professionals, we are also here for you.
All right, doctor, thank you for your advice. And for all of you who are at home and might be feeling overwhelmed with emotions like depression and anxiety, you can visit adaa.org for information on coping strategies. And you can call the Disaster Distress Helpline at 1-800-985-5990. We'll be right back. That's it for us today. Until next week, be safe. For Face the Nation, I'm Margaret Brennan.